Hi friends, welcome back once again. So we'll continue with the safety aspects in computer tomography. In the first session, I already mentioned you about automatic exposure control that will be covering in this upcoming sessions. So today in this session, we will be dealing with automatic tube current modulation, which is a dose optimization technology in CT that automatically adjusts the tube current, the MA, during scanning based on the patient's size, shape, and tissue attenuations. So its goal is to maintain consistent image quality while minimizing the radiation dose, which is aligned with the ALARA principle. Why is automatic tube current modulation is important? It helps reduces unnecessary radiation exposure, also which maintains uniform image noise. It helps compensates for patient body habitus, example higher BMI cases and higher MA wherever required. In these conditions, which help to compensate for patient body habitus, and accordingly the MA will be modulated. It also optimizes dose in multi-phase studies. We know that very widely used multi-phase CT investigations such as CCT, abdomen, thorax, etc. So these scans we can be able to optimize dose by using automatic exposure control or automatic tube current modulation. Also, this is particularly relevant in your CT dose optimization research context too. So the tube current is just adjusted in real time during the scanning of the patient. Also, on the basis of the difference in radiation attenuation in the transverse or XY direction and longitudinal or Z axis, that is the patient axis. So first we'll look into longitudinal modulation, that is nothing but Z-axis modulation, that is the patient axis. So longitudinal modulation adjusts MA along body length. So you can see from this picture the yellow line which is passing through, that you can see at the shoulder level, you can see the yellow line is at 400 MA. So when you go on at the chest level, you can see that it is reducing nearly 100 and below 100 somewhere in the chest thorax level, and again at the abdominal level there is a slight increase you can see, and when we move on to the hip level you can see the further increase in the radiation dose. So according to the body length, when the attenuation changes, the tube current is automatically modulated here. So that is what differences in attenuation among body parts. As we know, the chest is completely air filled, so the attenuation is significantly less, so lesser dose is used. But while going down abdomen, again a slight increase in the attenuation, so again the radiation dose is little bit higher, and at the pelvic level it is further increases. So here the example is thicker body parts will attenuate the radiation more than the thinner body parts. So the technique is to change the MA automatically as the patient is scanned, maintaining a uniform noise. Now we'll look into angular modulation. What is angular modulation? Angular modulation is nothing but XY axis adjust MA as tube rotates around the patients. So the radiation attenuation varies from AP, that is low attenuation, to lateral, that is higher attenuation, as the tube rotates around the patient. So you can see from here, so in the picture you can see one the direction you can see anterior to posterior. So the thickness is lesser, the passage of the radiation is lesser, but while coming to 2 from one lateral aspect to other lateral aspect, the thickness is higher. So that is what the difference. When at the level of 1, the radiation dose MA is modulated according to the thickness, so it will be less, and while coming at the level of 2, the radiation, the MA will be automatically modulated to a higher level, which needs to pass a greater coverage. Again, when it comes to the third, again it is direction from posterior to anterior, again it will reduce, and again at the fourth level again it will be increasing. So this is what the angular tube current modulation, and higher attenuation projection will require a high MA compared to the low attenuation projection. XY axis modulation maintains the similar constant noise level as we have seen in the Z axis modulation. So now we'll look into the combined 3D modulation, that is nothing but angular longitudinal modulation, that is also called XYZ modulation, which uses both angular and longitudinal adjustments. You can see from the picture the XY axis and Z axis modulation are used together. First picture I have already showed you, that is nothing but Z axis modulation as the patient body length, and the second picture which is showing the angular modulation. So fully automated dose modulation in X, Y and Z direction in real time. So we'll look into the basic advantages of dose modulation, that is nothing but more consistent signal to detectors, and also image quality is maintained at a constant level. So sometimes if you are using a fixed MA, so what happens, that MA will be appropriate for a particular attenuation, but it may not be, maybe with a higher attenuation structure it may not be suitable. So the image noise will be greater in a fixed MA protocol, but in the automatic tube current modulation, the automatic exposure control, image quality is maintained at a constant level, because when higher attenuation structure comes, the tube current increases. When low attenuation comes, the tube current automatically decreases. So the noise level will be constant, so maintained at a constant level image quality. Also tube heat capacity conserved, because it is not a fixed MA, so it is going down, it is going up, so you can have a bit more tube life as well. And reduction in photon starvation streak artifact, dose optimization, dose reduction from 10 to 50% dose reduction you can achieve, also able to set reference or noise level. So in this small session we have covered automatic tube current modulation, angular, longitudinal, X, Y, Z modulations. So we have to go into more dose reduction strategies in CT. So thank you for listening. So in next session we will have more discussion about dose reduction techniques in CT.